Hi everyone, my name is Karley and my partner on this project was Yolanda. Today I'm going to talk about a really important issue that doesn't always get enough attention, substance use among nurses in the United States. The infographic we made breaks down three main parts of the study we reviewed: the type of research, why this is a nursing problem, and what we learned and found surprising after reading. So let's start with the research type. This was a quantitative study, which means it focused on numbers and statistics rather than interviews or stories. The researchers used a cross-sectional survey, meaning they collected data from nurses at one point in time instead of following them over months or years. They surveyed 1,170 registered nurses from 9 states across the U.S. The question focused on substance use, things like whether nurses used illegal drugs, misused prescription medications, or showed signs of substance use disorder. Since this study used real numbers and measurable data, it gives a clear snapshot of how common the issue is in the nursing profession. The problem this study focused on is substance use and misuse among nurses. Basically, it looked at how often nurses were using drugs or alcohol in an unhealthy way, and how that might connect to their work environment. The results were pretty eye opening. Around 6% of nurses said that they have used illegal drugs, almost 10% misused prescription type medications, and overall 18% screened positive for substance use problems. What's really concerning is that 6.6% met the criteria for a substance use disorder, which means their use was affecting their ability to work or live normally. These numbers are higher than what we usually see in the general U.S. population, which tells us this is not just a personal issue, it is a professional one that affects patient safety and the nursing workforce. Now you might wonder, why is this considered a nursing problem, not just a health problem? Well, when nurses are struggling with substance use, it doesn't just affect them. It can lead to medication errors, slower reaction times, and poor decision making on the job. That puts both nurses and patients at risk. It also affects the whole workplace. Things like burnout, turnover, and staff shortages can all get worse when substance use is present. Plus, nurses often face high stress, long shifts, emotional trauma, and easy access to medications, all of which increase risk. So it's not just about personal responsibility, it's also about the pressures of the job. When we first looked at this study, we did not expect the numbers to be that high. We learned that substance use among nurses is more common than most people realize, and it varies by work setting. For example, home health and hospice nurses had the highest misuse rates, about 19%, while nursing home nurses were at around 15.8%. Nurses in hospitals had lower rates, and that just shows how work setting and job role make a big difference. Another thing that really surprised us was that nurse managers and charge nurses had higher odds of substance use disorder compared to educators or researchers. You'd think leadership roles would lower that risk, but they actually come with more stress and responsibility, which may increase the chance of misuse. We also learned that prescription drug misuse, nearly 10%, is higher than the general population. That is a big deal, especially since nurses often have access to medications. Overall, this study taught us that substance use in nursing is a serious but fixable issue. It's not about blame, it's about recognizing the problem and supporting nurses with the resources they need. Programs like wellness initiatives, recovery options, and stress management support can really help. It is also a reminder that we need to care for caregivers, because when nurses are healthy and supported, patients are safer and the entire healthcare system works better. Anyways, thank you for listening. Also, I apologize for cutting the infographic in pieces, but YouTube would not let me submit the infographic. Anyways, thank you and have a great day.